IHH Healthcare Bhd says the implementation of the Goods and Services Tax in April will have a mixed impact on the healthcare sector. Executive Director Ahmad Shahizam Mohammad Sharif says the impact hinges on the types of healthcare services and the parties that provide the services. He says independent or private specialists who work with hospitals are likely to be charged GST on their consultation fees.
The implementation of the GST framework in Malaysia, actually for private healthcare specifically, it's actually going to be a mixed impact. The reason why it's a mixed impact is actually depending on the different types of services and who provides those services, there will potentially still be a GST element.
Shahizam, who is also the CEO of Pantai Holdings Bhd, explained that while the in-house doctors are GST exempted or zero-rated, the independent or private specialists and consultants are classified as standard-rated GST services providers.
For their services, for their consultation fees, there will be that element of GST being imposed. And this is particularly for services that they do either for an inpatient setting, that means a patient that's actually in our wards, or for those patients who are being seen in their clinics, if their clinics are not directly registered under the Private Healthcare Facilities Act.
Asked if the margins of the healthcare industry will be squeezed upon the implementation of GST, Shahizam says the immediate concern is not on the value-added tax, but on the inflationary pressure.
For us, it's not really GST related that we're particularly concerned about, and in fact there's none that we would attribute to GST. The biggest concern is really in terms of if wages or salaries are also going up. So for instance, if there's general inflationary pressure, we do actually have to reflect this in higher staff salaries, and that's where we normally then would actually adjust prices where we need to.
He notes that over the medium to long term, there will be an impact on the healthcare industry due to the higher costs of living, which would eventually lead to higher staff costs. Shahizam was speaking to the HTV at a IHH event in conjunction with the group's presentation of 2 million ringgit in aid to flood victims. Charlotte Chong, the HTV.